You go. You go. I won't let you go. Paris, I won't.
Inclusive design is thinking about, would everyone be able to interact with that park?
We are smart citizens and let's become smarter together.
And incorporate these practices into your everyday routine.
And we really need to help, any possible way that we can.
Because so many of these people out there are suffering and, we're just very blessed.
Women need to feel that they're in the presence of other reliable, responsible, and justice-driven women to further fuel their drive to excel.
If you're improving 1% a day, you'll improve 365% by the end of the year.
Tech is accessible for every Filipino youth, regardless of their gender or socioeconomic status. We all have our own biases of how things work. Like how would I design things? Like why would I design things in a certain way? Because in my head, I'm the one who's gonna use it. But in reality, right, what about everybody else? How are they gonna use this product?
In your team, you need to create that safe space that they can say whatever they want to say within the context of work pa rin, syempre. Like, if there's a certain process that needs to be cut, or if they think that we're having too many meetings in a week, sige, let's consider removing some.
Most of us are using mobile devices. Most of us are spending time online. So cybersecurity is everyone's responsibility.
Hi everyone. I hope you can hear me. So today we're gonna have Dr. Gia. It's a pleasure for us to um, have her in our webinar series for WPM Manila. So let me just introduce Dr. Gia Sison for you guys. So um, Doc Gia or Gia Grace B. Season is a medical doctor, breast cancer survivor, and mental health advocate. She graduated Doctor of Medicine from the University of Santo Tomas, Faculty of Medicine and Surgery, Masters of Occupational Health from the University of the Philippines-Manila, and specialized in Occupational Medicine in the University of Illinois Chicago School of Public Health and Hygiene. Currently, she is the head of Women's Wellness Center at Makati Medical Center. And today, she will be talking or will discuss ways on how to cope with the emotional toll of pandemic to our well-being. So, guys, please welcome Miss our Dr. Gia Sison.
Hi, Justin, and good afternoon to everyone joining the webinar this afternoon. So I'll just share my screen. Okay, so I hope you see my screen. So our topic this afternoon will be about coping in the time of pandemic. And let's first set the tone para sa discussion this afternoon, which is the definition of mental health. So when we talk about mental health, dati kasi it's always negative, no? But after the mental health law was passed, we started to look at it in a different way. So mental health in general is a state of wellness where everyone realizes that he or she has potential. We are able to cope despite the stressors in life, just like what happened during the pandemic. We can work productively. We have positive relationships, and positive relationships don't always mean no fights. No, in fact, there will always be conflict, but a positive relationship will always work to go through or learn from the conflict, and of course, you make sound choices as well. And very importantly, we are able to serve serve back sa community. So this slide is enumerates five amongst a lot of mental health concerns in a time of pandemic. But as we speak, there's no statistics yet on ilang percent pa ang nag-increase sa rates of depression, sa rates of anxiety. We don't have those numbers yet. But enough for me to say that almost all of us have been uncertain about what's going to happen. We have lost someone whom we know. Like personally, I lost an uncle because of COVID, and we adjust to how things will be from now on. And lahat ng emotions heighten. So we get extra anxious, we easily get triggered. And of course, as a doctor, there is already a glaring problem in terms of access, in terms of other services that are non-COVID. And so for those of you who are listening who are on a work from home setup or from a study from home setup, it becomes a challenge when we don't realize the ones flashed on your lower left. Because we have to remember our home becomes both our school and our workplace. So it's very important that despite the removal of yung social cues na tinatawag, we are very mindful about how we feel, if we're already feeling burnt out, stressed, acceptance of the situation, make do with what we have. Physical wellness is very important. Now, on your screen, don't forget that to still get that 6 to 8 hours sleep, maintain diet, exercise. And for me, ang pinaka-importante is learn how to set boundaries, both personal and professional. Kasi not naman, hindi naman porket 24, work from home is your 24/7 on call. So it's very important that you communicate your boundaries and of course respect for each other, and we all have to realize also that we approach work in different ways. And so, aside from COVID, there's already another additional threat of isolation and loneliness, which I hope uh, we start to create a community of care that doesn't leave anyone behind. But Pauline Boss actually studied losses. No, she did a paper on that, and yung kanyang conclusion was lahat tayo, we all suffer from ambiguous loss. These losses, hindi naman kailangan a loved one or a person. These losses might be loss of chance for a career upgrade, loss of chance or plan of traveling, etc. Any type of loss is loss, and that it she concluded that grief is something that we share. So it's communal. No, it's not like mag-isa ka lang. Whenever we hear about bad news, somehow we really get affected by it, and so there's such a thing as shared grief too. And on this slide, it just shows that it's a slide from the global burden of disease study that shows that there are higher rates of depression among women in all groups. And in terms of anxiety, higher rates of anxiety among women in all age groups. Now, why? There's no talagang outright reason why yet, no? But we can just guess, or we can just probably assume that they have more roles to play, etc. In this slide, how will or how did COVID-19 affect girls and women in general? There have been greater risk of exploitation and abuse. Although I don't have the numbers, but yes, we have been receiving a lot of calls about abuse. There's decreased access to sexual and reproductive health services kasi nga it's all COVID concentrated. And of course, on your far right, there's increase in unpaid and domestic work on women and girls. So we have to remember that mental health services are usually gender blind. When we say gender blind, it doesn't matter what gender you are. As long as you need it, it's there. And a gender responsive mental health care has to consider these specifics like developmental stage. Kasi iba ang needs ng teens sa 20 years old to 30 years old. So it has to take into consideration yung needs based on the developmental stage. And in terms of treatment, we consider the context also of the person. And iba-iba yung effect ng gamot sa iba-ibang tao. And of course, we need to establish safe inpatient care. And again, if I may add, a safe community care as well. Because mental health services should also go out of the hospital and be on the community. And so we discuss about stressors kasi lately, ang laking stressor ng COVID. However, when we define stressors, we have to look at it in a light na it may be negative, pero it can actually be shifted to something positive in terms of life changes. And for all these to happen, we all need to learn the art of coping. And coping is various. Coping may be different. But on the next slides, I'll be discussing some tips, general tips, which I hope can help you. So there are two types of coping, no? We have the active coping and the passive coping. When you say active, you realize that there's a problem, then you act on it. Versus passive coping, where alam mo may problema, pero wala yan. You continually deny yourself that there is a problem. And so, nagkakaroon ng mga band-aid solutions. And in cognitive behavioral therapy, that's the one you see below on your far left. If that's what we ask ourselves, no? Is this situation something I can control? If I can, then I act on it. Now in the middle, if I can control it, pero maiiba ko naman the way I see it, I can control my thoughts and reaction towards it. Then I apply emotion oriented approach. But on your far right, if there and it's a fact na there are some things that you really can't control, then we apply acceptance oriented approaches. So coping step number one is really to acknowledge and to apply radical acceptance. Active coping requires being aware of how we feel and being real with ourselves. It also requires us to actually name our emotions. Let's put a label on that. Are you sad? Are you anxious? Are you feeling down? Or are you feeling happy? Or are you looking forward to something? And analyze why you feel those emotions. And please don't forget that feedback is very important, most especially when you cope. Kasi may mga bagay na we really don't see within ourselves. This is the time when we need others to actually give feedback to us na on how we are. It's actually part of coping and growing at the same time. And radical acceptance, it means we make difficult times as our baseline, as our foundation. And when you say radical acceptance, and when we apply that in our lives, we actually allow um, our energy to divert our thoughts into more constructive uh, things, constructive circumstances, rather than dwell so much on the torment of what we are experiencing now. And then, speaking of naming your emotions, this is based on Harvard Business Review. Susan David actually named, no? She said, go beyond the obvious to identify exactly what you're feeling. So, highlighted on the top are the six common emotions. Then, sa baba, these are actually just parang synonyms for these. Bottom line, both positive and negative emotions are equally valid. And based on this study, it just shows that the more we acknowledge the way we feel, that's the upper part of the graph, the better we cope. Versus someone who feels it, then constantly denies na it's not there. So, mas matagal ang coping time. So, we have to remember that attempts to control our emotions actually just amplify them. So, they're also meant to be expressed, no? Not suppressed. And in anxiety management, there are also practical ways in addressing it. Now, there's deep breathing exercises. That's the one to your lower right. So, as it balloons, count 4 and hold your breath for 7 seconds, then exhale in 8 counts. That's the 4-7-8 technique. And you may also want to do this to be able to at least release the stress that you feel. And mindful.org has actually a very nice mindfulness exercises that we can all practice, especially when anxiety hits us. And the tip here is the more we practice it, the more uh, it benefits us. And so, coping skill number 2 requires us to reframe our thoughts and adjust our expectations. Everybody or every one of us, we have thought patterns that are unique to us. Sometimes it's a simple question of asking ourselves, why do I constantly dwell in this thought that isn't true? Or why do I constantly dwell in this thought that's hurting me instead of allowing myself to grow more? So thought patterns actually help us in terms of coping, and that's very important. And all of us, we've had plans before March, specifically when COVID blew up. Uh, it was all postponed. But postponed plans doesn't necessarily mean canceled plans. We just have to adjust our our plans again, be flexible with it, and manage our expectations to be able to cope. And going back to feedback, Remember, the skill number one requires feedback from others. Brene Brown is actually a very she's an icon in terms of being vulnerable and giving feedback, and she says that you take feedback from people who matter, because you can't take criticism and feedback from people who aren't really being brave with their lives. So it's important that you get feedback from people who've actually been there. So that's a very important point in terms of kanino ba ako hihingi ng feedback. And of course, coping skill number three, reduce stimuli. Like this game, this is a game of Tetris. The question is, which is more difficult to manage, A or B? The answer is really B, no? Because in the game of Tetris, all of these blocks, they fall at the same time. And you have to adjust them accordingly kung saan yung vacant slot. So parang life yan, no? The more things we are surrounded with, the more overwhelmed we become. And so the key there is compartmentalize. What is your top two or top three priorities and focus on them. The rest, uh, parang itatabi mo muna siya para lang makakonsentrate ka dun sa top three priorities. And we also cope through mindful dissociation. So it's not also healthy that we are exposed every day to negativity. It will really affect us one way or the other. So it's important that we anchor on source of hope, source of inspiration also. Para naman there's something that we can look forward to na uh, parang, yes, there's still hope. And of course, mental health and media, needless to say, we really have to regulate our use, no? Because it's always there. The key there is choose your credible sources, and if it makes you, if it already like causes you toxic feelings, get out of it. So limit notifications as needed, or even go on a social media detox, no? Because it can help us all recalibrate. And again, coping skill number four, it's so important that you learn to seek support. No, we can't go through everything alone, and practice self-care and create routines. No, every day it may be tough, but creating routine, like this is my plan for today, creating that gives us a sense of control, and be deliberate when taking breaks. No, you have to inject also self-care practices, and don't forget the pillars of health, which is physical and sleep. No, so routines actually can help us cope, especially again when the home becomes your workspace, becomes everything. No, kasi of course we all know that going out is only needed pag talagang kailangan na. Remember that there's no one size fits all when it comes to self care. Everything or everyone varies, and they're all equally valid. But we also have to adjust it accordingly and recalibrate. And on this slide, on your left, these are the types of self care. Pwede siyang physical, pwedeng emotional, pwedeng social, pwedeng spiritual. So, in whatever way you feel that you are comfortable with, then go do it because we all need it. And self care is an everyday choice we make, and we have to amp up on the practice of self care. And speaking of sleep, the most important points on this slide is if to avoid caffeine, spicy food after 4. Kasi pwede na siya maka-apekto sa quality of sleep natin. And make sure that you sleep on a dark room, because exposure to light actually diminishes the stimulation of melatonin. We all know that melatonin is the hormone we need to be able to relax. So practice sleep hygiene because it's very much needed, most especially to boost our immune system. And of course, healthy diet. Cut down on, again, carbonated food or sweets. It's okay to eat them, but in moderation. And remember, self care isn't always about pampering oneself. Sometimes it's about doing the painful things that ultimately do you good. Paulo Coelho really summarized self care in a very beautiful quote. He said that when you practice self care, it's actually saying no to the usual things you say yes to. So basically, we don't want to turn people down. But if it's already stressing us out, if it's affecting the way we are, then I think we need to say no at one point in our lives. And remember, seek support. Seeking support is actually a step towards developing resilience. And sharing of personal experiences can actually help us cope. So seek support if you can. And there are a lot of venues now where you can actually seek support. One of them is Argao Center. Red Sargao is a good friend and he's a clinical psychologist. You can just reach out through his email and he can schedule you. And of course, we have the National Center for Mental Health, Health's USAP hotline. And they have already actually um, expanded their reach in terms of they're already open to online consults. And I have a website, padayonph.com, where you can actually look for possible sources of help. So help is out there. Don't forget to reach out to a professional if you feel the need to. And lastly, coping skill number 5 tells us that no matter what happens, let's all build on hope. Hope requires us to anchor on a better future. COVID has destroyed a lot. However, it doesn't mean that it has destroyed it forever. We can actually build it collectively and envision a better and a just future. Remember, the future is not cast in stone. There's a future that we can all collectively shape. So, as I end my talk, I just want to summarize the coping mechanisms that I have discussed earlier. And that's to acknowledge how we feel, dissociate from things that doesn't serve us or make us feel toxic, reframe our thoughts, practice self-care, and anchor on hope. So with that, thank you so much. And thank you again to Women Tech Makers Manila for inviting me this afternoon.
Thank you so much, Dr. Gia Sison. Everyone, if you have questions, you can just comment on this live stream. And if we haven't, or if we didn't see your comments, we'll directly send it to Miss Dr. Gia. So thank you, Dr. Gia Sison, for your
Thank you,
time.
Jess. Thank you,
For
Jess.
sharing your knowledge. Thank you so much, everyone.
We all have our own biases of how things work. Like how would I design things? Like why would I design things in a certain way? Because in my head, I'm the one who's gonna use it. But in reality, right, what about everybody else? How are they gonna use this product?
In your team, you need to create that safe space that they can say whatever they want to say within the context of work pa rin, syempre. Like, if there's a certain process that needs to be cut, or if they think that we're having too many meetings in a week, sige, let's consider removing some.
Most of us are using mobile devices. Most of us are spending time online. So cybersecurity is everyone's responsibility.